Hello and welcome to Viewpoints. Today, we're going to welcome to our show Katie Donovan. I met Katie several years ago as she was a keynote speaker at a conference. She has spent 20 years prior to where she's at now in marketing and communication industry. But when her daughter developed a substance abuse disorder, she left her career to focus on her family and the long road to recovery and that journey. Katie has been featured in Time and Money magazines. She's been interviewed by Fox, Fox Sports, ABC, NBC. Her website, Mother's Addiction Journey, has reached over 1 million views. And we are grateful and fortunate to have her with us today. Katie, welcome to our show.
Thank you so much, Sherry. I'm just so excited to be here.
You have just an incredible story, about substance abuse and the disorder. But today I want to start our conversation with the stigma and the judgmental attitudes of people. You know, we all have biases. That's a hot topic right now, is our biases and our unconscious bias. But tell me, when the opioid crisis first took hold, I heard those judgmental comments myself made not only about those with a substance abuse disorder, but also directed toward the family. Those type of comments have decreased over the years as the knowledge of the opioid crisis has grown. But can you tell us, I'm sure you've experienced those comments, how do those impact the family and how did they impact your daughter?
That's a really great question. I think it's a really important topic. In the beginning, I really wasn't familiar with addiction, to be honest with you. And especially when it came to an opiate. In fact, I didn't even know what an opiate was. And right. I just knew the word heroin, but it was always said in more of a whispered type of format. And when my daughter came to me and was begging for help and crying and saying that she thinks she is addicted to heroin, I was so taken aback because I thought, I raised you right, quote unquote.
Right.
And my only real exposure to heroin and addiction was really what I saw in the movies or what was on the news, and it usually wasn't portrayed in a positive light.
Right.
And I thought, that can't be it. What I didn't see when it came to that was my daughter. And I just remember feeling, wow, we taught you about saying no to drugs, right? Not drinking and driving. I know you're going to experiment. We can't be fools, but I never thought it would be that kind of a substance. And those that did those kinds of substances, I just viewed them ashamed, to say this, but as bad people. Stay away from them, right? You are who you hang out with type of thing. Fast forward, I know so much differently now. They are mothers and fathers and children and our coworkers and our friends and everyone in our community truly is affected in some way, shape, or form. But yet, even those that are affected can still have this judgment if it's someone else. I vividly remember going to an emergency room when my daughter had an overdose. And it was in the middle of the night and I was frantic and I flew in there like, my hair is all over the place and you're just not thinking correctly and you're panicking and you don't know what is happening. And I ran in and I asked security, where is my daughter's bed? Like, I got to get there immediately. And he pulled me aside and said, "You're not going to cause any trouble now, are you?" And then as I walked into the room, I overheard a nurse say, "Oh, the junkie's mom is here."
Oh.
And I was so shocked because here we are in a medical facility at that, who were supposed to be treated with kindness, support, and I was angry. I was very angry.
Right.
There are other sayings throughout the years that I've heard as well, and a big one is, "Where were the parents?"
Yes.
And I think we've probably heard that in all kinds of scenarios, right? You see it on social media. Oh, it's all comes down to the parents. Maybe it's a single mom, or it's this, it's that, and really, that's us being so judgmental, not knowing a situation. Now, of course, there's circumstances that are unusual, and it certainly can have an effect on the children if the parents aren't in a safe situation, et cetera. But in general, none of us are perfect, but we're doing the best that we can.
Right.
And I now understand how it's the disease of the brain, and it has nothing to do with how you raised your child. It has nothing to do with their morals. It really has to do with mental health and how their brain and body, as my daughter says, my body just loved it. And I didn't realize it, and I couldn't stop.
Yeah.
It's
And
challenging as families. Mm-hmm.
I heard a interview with your daughter, and she said the first time she tried, uh, she didn't know she was using heroin. Um, and she said for the first time ever, she felt like full of joy and so happy. And that's really hard to prepare our kids for, no matter where
Mm-hmm.
we are in society, uh, that they're going to feel that. I don't know. You know what I'm
Right,
saying?
right, right. And for so many, this is what is scary, that it's in pills now, and it's in marijuana or all kinds of other substances, and they may not realize it. But something happens where it may fill a void that they've been feeling, not knowing, but it's filling something, and it's that feeling that is the chase. It's not really about, so many think it's just about getting high. Sometimes it's really filling a void. And sometimes the only time they feel peace is with that substance.
Right. Um, so in public safety, uh, we're usually dealing with people after they've used, whether it's the 911 call or the responders. Um, what kind of what would be more helpful from us in public safety when we receive those calls?
That's a really great question. I have such empathy for first responders and public safety, because they're dealing with this type of crisis all day, every day. And I'm sure they become very immune to it, or maybe even become frustrated and angry. Maybe it's the same house over and over again. And I would ask that when you pull up to a situation and it's a suspected overdose, approach that situation like it's your own family member. Approach the family like it's your own family. Are you going to say and do everything you possibly can to help them in a supportive way?
Right.
Knowing that sometimes the family doesn't know what to do, and they either call the police or they call 911 because they're helpless. And sometimes first responders, that's their hope, that's their light. Treat the situation like it's your own loved one.
I know you've had several encounters with 911 personnel and first responders. We have strong personalities in public safety. Um, we want to be the hero. We want to come in, and I mean that's why we got into the profession. No matter where we are at in the public safety realm, it's because we wanted to, save people, make a difference. Um, and yet, many people in public safety have their own addictions and their own mental health struggles. Um, you're familiar with that as well. How do you feel like agencies can come alongside those people who are having internal struggles?
Does the policy reflect how you feel? Your work policies. Are you supportive with your internal personnel? I'm sure there's trauma, so much trauma that they have seen, you have seen, that it can have such a tremendous impact on how they're feeling. And knowing that someone may struggle with something, how does their policy reflect that? Meaning, so often in these types of situations, they're let go. I understand that if someone is under the influence and they're at work, that's a danger for sure. But can they approach it in a situation of empathy? It seems like you're struggling. I'm very worried about you. I'm concerned. How can I best support you? What would you be willing to do? Would you be willing to seek therapy? Would you be willing to do outpatient? Maybe it's to the point of maybe needing true inpatient and holding their positions for them versus completely letting them go. And then they have no insurance, feeling like they've lost everything. Most often, the shame of continuing to use and feeling like you can't stop keeps them in this situation, keeps them in this cycle of being embarrassed, not wanting to reach out. Does your agency have a program in place, a supportive program in place where someone can feel comfortable to share this, where someone, I feel that when we share our stories, it allows others to share as well, knowing that they won't be judged, knowing that they can share without being pointed at and feeling ashamed. They don't want to be this way. Can agencies look at this really as a behavioral health true issue versus a moral issue?
Wow. I'm thinking as you're talking, I'm thinking about policies that I'm familiar with and marijuana. You mentioned marijuana earlier, and I know that there's marijuana out there that's been unknowingly laced with fentanyl, for the user. And I think about, even though it's legal in many states, uh, some states still have a no tolerance, zero tolerance for marijuana usage, even in the states where it's legal. Um, and they have those no tolerance um, policies because if someone comes on duty with those drugs in their system and they make a mistake, there's all kinds of liability there, both on the person and the agency. But
Mm-hmm.
so I understand what you're saying about supporting them. How do they balance that? Having some tolerance and still, holding their agency, first, kind of.
Does the leadership have a rapport? Do they have a relationship with their staff? It's that connection piece that is so imperative to have that strong relationship. Are you able to ask someone, not how are you? Do you know their family? Do you know the specifics of what's going on in their life? Balancing the legalities and I'm not familiar with how it may work from a protocol level from the state, but many, let's just say, businesses, corporations can have their own internal policies when it comes to substance use, even behavioral health. If someone maybe is clinically depressed, maybe they're bipolar, right? All kinds of things can happen that can still have very similar effects on their day-to-day duties in their job. With 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 substance use, do the policies allow them to be on medication that can help support them through this?
That's a good point.
And and if there is a very strict one and done type of scenario with legalities, is there a different location, or excuse me, position within the organization that they can be in for a period of time instead of losing everything? I think it's really, really important to look at this as a sickness. And if we have one and dones, that can drive someone further down. And it also, I think, increases our attitudes toward addiction, towards behavioral health in a negative way. Maybe that person now can't get a job in the future because of how this has affected them.
Right. So they, even though they may, be able to, I don't know what the correct term is, be clean. Is that the correct term? Right.
I think sometimes, right, there's so many language that is suggested that we use. Clean, I think it's a very common term when we think of that. Oftentimes it's used, we can use the word, their disease is in remission.
Oh,
I think
yes.
It's also important to recognize that there's a really big difference between socially using substances, being dependent on substances, and full-blown addiction. There are different phases that this can go in, and maybe someone really doesn't have a true substance use disorder. They've just become dependent on something. And I think, given the example of COVID, which I know we're also exhausted of talking about, and the word just kind of, gives me chills up my back, but so many got in the habit of having a cocktail in the evening, right? Can't go anywhere. Let's have some board games, do some puzzles, and we'll have a cocktail. And it turned into a habit, not necessarily an addiction. It turned into a habit of having one at 5 o'clock, 6 o'clock. And is that still in their system the next day? Are they going to be penalized for that? We really have to look at the full picture here.
Well, so there's several different levels of usage. So you were talking specifically about alcohol, but relapses are real. Why do you feel we blame only the person experiencing the relapse? Do you feel like there are other factors, and we kind of did just talk about them, that cause people to relapse?
Oh, tremendous amount of factors. And it can really infuriate me when society may put all the blame on the individual and use certain phrases such as, oh, they just didn't want it bad enough, or they just weren't committed. There are so many factors to someone having a slip or a full-blown relapse. It could be maybe they did go to inpatient treatment, and when they got out, they didn't have a safe place to live. Maybe they went back home. Let's just say they've lost everything and they need to go live with mom and dad if it's an adult. It's very shameful. It's very embarrassing. maybe mom and dad haven't been educated on what can happen and how they can be best supportive when someone does get out of a treatment facility, because there's so many emotions that they can go through. There's post-acute withdrawal syndrome that can have an effect on how someone recovers. Maybe they're sleeping all the time and mom and dad are like, just get up and get a job. It's what you need to do. Right. And
Right.
not understanding that their recovery is a medical thing. It's not a laziness, quote unquote, type of thing. Maybe their economic recovery hasn't been worked on. Maybe they've lost their license. Maybe it's difficult to get a job anywhere. They can't pay bills. All of this scenarios that they've numbed themselves with using the substances are now coming to real life. The consequences of their disease is coming to real life. And that can be really difficult to handle, especially when, if we're looking at treatment itself, it's really insurance driven. And maybe their particular health insurance only covered 5 days. Well, how can someone just quote unquote be cured
Right.
in that short amount of time? Or let's just say 2 weeks. It's very, very difficult. You can't just change everything. Trauma hasn't been worked on. There's so many different things that can affect this. And let's say, for example, also, maybe they had an incident, let's say alcohol related or even substance use related, that they ended up with an OWI or DUI type of situation, and they had to spend some jail time. Now, it's almost impossible for them to find work to have
Yes.
that. And they want to find a place to live. Background checks are happening. They don't have now. It's so it can just really devastate someone's future because of these things that have happened, because their body is saying, I need more, I need more, I need more. And if we are looking at this as a society, as a disease, we must treat it as such. We must treat it as such.
Wow. You talked a little bit about insurance. So when I was preparing for our talk today, there would be some research that would indicate that the opioid crisis itself started with prescription drugs. The National Coalition Against Prescription Drug Abuse stated that in the 1990s, pharmaceutical companies began really increasing their production of prescription medications, and to use those that increased dosages, they were encouraging doctors to prescribe them more, saying, these are not addictive drugs. And yet now we're looking at where we are. Health Resources and Services Administration report that more than 130 people die each day from opioid-related drug overdoses.
Mm-hmm.
And so here you are talking about insurance, and that it doesn't support people, and then we have the other side of the insurance prescribing more and more drugs. There's programs out there. In fact, I know that you were instrumental, the leading force in creating the program called Hope Not Handcuffs.
Mm-hmm.
What can you tell me about that? I don't know if that's available all through our whole country, but how can people look at starting something like that if it's not available in their area?
So I was watching a news video one time, and it was about a chief of police in Gloucester, Massachusetts, that put out a call to action to his community. And he said, I am tired of arresting people for the same thing over and over again. And most of it is petty crimes, and it's due to their addiction. I want to help you. And he said, walk into my police department and I'm going to get you into treatment. You will not be arrested. Nothing is going to be held against you. And I thought, whoa, this is amazing. Can we do this here? Is that even an option? And so I started to put some feelers out, getting together with chiefs of police in our own area. And quite honestly, at first, it was absolutely not. There's no
Right.
way. This is not happening. It would be changing everything that we do. If
Never
someone
done it that
commits
way
crime,
before.
right, right. We have a duty, et cetera, et cetera. And it was in the sharing of stories. Do you love someone that struggles? Every single one did. Whether
Wow.
it's someone that they was really close to or that they had a relationship with, and they saw the impact and then realized, wow, I guess we do have a power to make some change. And they got on board. And it is available in Michigan. There are other areas throughout the country that it's not labeled as that name of a program, but there are many, many in almost every single state now, programs that allow you to walk into a police department and ask for help without fear of being arrested. And they are going to do everything in their power to help you. It also then had this unbelievable, beautiful ripple effect to the court systems, to judges, to probation,
Oh,
starting to see this more as we have a duty to help someone. And sometimes it's not with jail time because of the ripple effect that it can also have in a negative fashion on the back end. Isn't our job to help make them the best version of themselves, be productive members of society again? And how can they be productive members of society again if they have all of this on their record?
right. These type of programs, you were saying if they come into the police department, what if they begin with the 911 call and the PSAP sends responders to the house? Can they still say I need help and experience that grace?
That's a very good question. That is really, it depends on the agency responding to the call. I think many agencies want to do something, but they're not sure what or how. And they're also overwhelmed with calls. They're overwhelmed with being pulled in so many different directions. If you're an agency that doesn't have something set in stone, there's opportunities out there within your communities. Reach out to them because they want to help. And whether it is, for example, I also started an overdose outreach program in Michigan, and it was the very first overdose outreach program where if an agency responds to one, it's put into the system, and within a few days, an outreach team goes to that location and they offer assistance. And it doesn't necessarily have to be going to treatment. It's building a relationship. Maybe they're in an unsafe living environment and they can try and get them into a better living situation. Maybe they don't have any food and let's get you into take you to a food pantry. Maybe they have abscesses on their arms or legs or what have you, and they can medically treat that at that time. If the family is there, they can provide them education. They can provide them with the life-saving medication of naloxone, where they can really protect themselves and save their loved one in the meantime. There's options, and I'm happy to let anyone know too in their areas. If they're not sure, feel free to reach out to me and I'll do my best to direct you of where to go and start that. But honestly, when I started Hope Not Handcuffs, I didn't know what what to do, right? We're just winging it.
Right.
We have no money, but we had power and passion, power and education, and power and love. And I thought it's better than doing nothing. So many say, oh, we got to fix this. We got to do this. Are you willing to be the change maker and give it a whirl?
Um, I've I've probably said it. I know it's been said. If I can make the difference in just one person, then it's worth it. Um, how are these programs? How are they making a difference
Mm-hmm.
to, to people and families?
Mm-hmm. So many have said that these types of programs have completely saved their lives, saved their families, saved relationships. They have holidays together with their loved ones now instead of having to visit them in a grave. Oftentimes, many don't know where to turn and they think there's just no help. There's no help. Sometimes they feel, well, I don't have any insurance, so I can't do anything about it. To know that there's places that have this information and making it as simple as possible as just popping in or making a phone call, and literally probably within 24 hours, they can be in a treatment facility. There's grant funding in almost every location that will cover 100% of the cost. And then there's step down programs such as what's called a recovery home or a sober living home. And it's a safe place that an individual can go after they've gotten out of treatment to really help build their lives. They're surrounded by others who have been through the same thing. And there's rules, there's testing, but they support you to try and get jobs. They support you in really trying to become who you really are inside again, finding your light again. And as a community, we need to support that. We need to look at these, even for my own daughter, I'll be honest. She's been using substances for about 13 years now. And when she calls me and says, I need help, Mom, quite honestly, she's been to treatment 31 times. And this may sound a little woo-woo, but I am more proud of her for every reach out than if she would have gotten her PhD, because she doesn't stop fighting. She doesn't give up. She keeps going. She stumbles, falls, but she keeps fighting. And to me, reaching out is the most courageous thing that someone can do, because this
Yes.
disease takes over your entire body, mind, and spirit. It makes you feel like you're nothing and you're not worthy. But there's something there sometimes. You keep reaching out, you keep going, you keep fighting. That's amazing to me. I see comments often of if someone is homeless and maybe they're holding the sign, right? The kind of envision that we have in our heads.
Right.
And you hear comments of, just get a job, lazy bum, this kind of thing. It's not that easy. If they don't have an address,
Oh,
they may not have a driver's license. They may not have identification. They may not even have their social security card. All of these things are needed to get jobs. And I just think as a society, we need to take a step back and look at this as it's affecting. There was a study done by the JAMA, I want to say it was 2020, that 2/3 of people in the United States love someone who struggles with substance use. 2/3.
That's a lot. That's a that's a lot.
Right, right. And with that, going back to the families that are affected, they're still trying to keep it all together, going to work, balancing everyday life, probably other children in the family. Maybe if they have a partner, they could be balancing that relationship because there's just so much heaviness and stress. Maybe it can affect how they're working in their job. And in this particular study, it showed the statistic that their productivity can decrease by up to 65% because they love
Jeez.
someone. And how do you call your boss one day and say, "Hey, I'm going to be a little late. Was at the ER all night because my daughter overdosed."
Yeah, probably something most people don't want to share
Right, right.
because of that stigma that we talked about earlier.
Yes, exactly. So sometimes, even as those that love someone, we're not doing the substances, but yet we can be affected very similarly with our jobs and our lives because of this. And going back to policies, procedures, do as a society or corporate culture and agencies, if you see someone's productivity, they're not as focused, something is declining, instead of putting them on a leave or some kind of consequence, have the conversation. Maybe there's benefits within your own organization that they're not aware of that can help them at that time to get through this. Look at them as an individual with empathy.
You're talking about the benefits. Most organizations have a employee assistance benefit program that you get 3 to 5 free visits, and I just have to laugh at that when I think about what you said earlier for people who have substance abuse disorders. Okay, you get 5 visits, 2 weeks, and you should be all better. And statistically, that's impossible.
It's impossible. It's
Right.
impossible. And what if it's not a good fit of a therapist, and then you've just burned a couple of visits,
Right.
or you do reach out for help, and then, oh, our next appointment is in 3 months. When you reach out, that's when you want the help, right then.
Right. And the mental health crisis that we're experiencing right now, uh, you can call facility after facility after facility. They're like, oh, well, we've got a waiting list, 4 months. 4 months.
Mm-hmm.
How much
Mm-hmm.
damage can be done to those people in 4 months?
Right, right. So I started an app, and it's in beta mode right now. But it is on demand coaching, most of it for free.
Oh,
And
nice.
it's all the different areas of wellness. It's mental wellness, it's emotional wellness, it's health wellness, it's financial wellness, it is relationship wellness, it's work wellness. If you have a boss that really ticked you off in that moment, and you go into your car and you're crying your eyes out, and you don't want to tell anybody at work, and a girlfriend isn't going to understand, you can have 15 minutes of venting to a coach that can take you back, because I believe that it's in the midst of the situations where the most impact can happen for a person. When you're in that moment and someone is truly, truly there for you, that can be the change maker in the direction that someone goes to after that 15 minutes.
I I think that's incredible. I can see so many other uses for it. I mean, and I know you're not just developing that app for addictions, but I think of, you said your boss really ticks you off. Just imagine how much less trouble people could get into if, when their boss really ticked them off, they had they had an outside view of it instead of venting to their coworkers who are going to say, "Yeah, you should know," and then then they're in
Mhm.
trouble. Just
Right.
that's great. What a great tool. Good for
I'm,
you.
I'm excited. Thank you.
Yeah.
Thank Yeah. We,
Um, I just have one more question for you, Katie.
mhm.
Because our audience wouldn't necessarily be able to ask you questions as they're watching this, what would you say the most common, or even the most couple common questions when you do public speaking? What do you hear the most?
I hear the most, excuse me, of, I guess they just didn't hit rock bottom. How do we help someone just get to that rock bottom? Also, um, really focused on so much negativity with this disease. Rock bottom has many levels, and it's an archaic term that we shouldn't be using. It is a term really based on the old alcoholic, sorry, the old alcoholic who, let's just kick him out of the house and let him figure it out type of mentality. People want to know how to make that change. The biggest piece is, can you love them at their lowest? Can you love someone despite of their behaviors, despite of the actions that are happening, despite of the pain, remembering who they really are inside and truly seeing this as the disease that it is, that their actions and behaviors are all the symptoms of their disease. The biggest piece is maintaining a connection, maintaining a relationship. I would never tell someone to kick someone out of their house. I'm not saying that one is right or one isn't, but we have to look at this a little bit differently. Cutting off all communication, cutting off love, cutting off a relationship isn't healthy for anyone.
Right.
But you can have a relationship where you're protecting your own self and still keeping in contact with your loved one. When we talk about unconditional love, that's unconditional love. If we say, don't call me until you get X amount of time clean, we're putting conditions on that love.
Right.
So approaching this in a way that is relationship and connection based with empathy, that's most important. And especially for families, also first responders, or anyone in any kind of outreach program, establishing that connection and maintaining a relationship, whether it's to get them help in any way, shape, or form. It's community driven, takes a village.
It does take a village. Uh, I just want to ask. I want to ask a follow up question to that. So, sometimes parents are at their wits' end. Their child has caused so much disruption in the household, and there are other children involved. There's a Christian hip hop singer, Toby Mac. I don't know if you've ever heard of him or not, but his son, when he was 19, they had to ask him to leave because of the disruption he was causing to the rest of the family. So for parents who are in that situation, you might not recommend that they tell their child to leave, but they're really kind of their backs up against the wall.
Their backs up against the wall. And when I say I wouldn't recommend it, it's more of, for me, it's uh, ethically. If I told someone you need to have them leave, the biggest fear a parent has is if they leave and something tragic happens.
The
That
what
can come
if,
back on me. I
right?
do want to empower families in giving that individual, their loved one, a choice. And let's say, for example, we have a nice, pretty suitcase filled with um, shoes, clothes, 2 weeks worth of clean underwear, right? And then on the other hand, we've got a garbage bag, the black hefty ones that, just stuff that's just thrown in there. I am going to fight for your disease because you're not able to right now. And I am fighting for you because I love you so much. Our home needs to be a safe haven. Our home needs to be safe for everyone. And I would love for you to take this beautiful suitcase and go into a treatment facility and get the help that you need and deserve and come back to us with open arms because we love you so much. If you choose not to, I'm going to respect that. And the other option is here's the garbage bag.
Mm.
And I'm always here for you if you want to take this suitcase in the future.
Very good
You're
advice.
giving them a choice. They may not like the choices,
Right.
but you're doing it with love.
Wow.
You're leading
Thank
with
you.
love.
Thank you, Katie. Is there anything you want to add? I mean, you've just been phenomenal, as always. I just really, really enjoy talking with you. Anything else you can think of to add?
I just want to honor you, Sherry. Truly, you have such passion in this area, and you see how agencies and the community can make a difference. And you're doing everything in your power to get that message out there. And I thank you for that because not many would do that. You're an amazing woman.
Well, I'm honored. I appreciate the comments. And before we close, I just want to remind our audience, it's always been, I love telling people, public safety, 911, there's so much you can do beyond answering the phone. Find your passion. This is an area, Katie just talked to us, that you can get involved. And I would just encourage everyone to find their passion and give back, because it really helps you in your career, and it's a good thing to do. Thank you so much, Katie, for joining us, and I wish you all the best on your continued journey.
Thank you so much, Sherry. It's been an honor. Take care.
Take care.